Peace be upon you and God's mercy and blessings in the name of God. And peace and blessings be upon the messenger of God. Moving on, there are many questions regarding the topic of D antigen and partial D. And the kits that we use, which are labeled D positive and D negative. Hey, Carlos Aratribre. So let's review together some things we have mentioned before on this subject. And of course, this topic has many, many details, but we will state what the general framework of the subject is. First, let's consider that this D antigen is composed of this entire structure as a whole, meaning its normal structure consists of 3 parts together: 1, 2, and 3. All of this together is what constitutes the D antigen. We have the first case, cells with the antigen in its cohesive normal structure, and also the amount of antigen on the cells, which we call what? The antigen sites. This amount is normal. So a complete normal structure and a normal standard quantity. This is what we call what? Or this case is the normal one. This is the second case. The cells have the D antigen with the complete normal structure, but the amount of antigen on the cells is less than normal. So it is a complete normal structure. But the problem is the quantity is a bit lower than normal. And this is what we call what? The weak one. This is the second case. The third case, we have cells where the antigen structure is not complete, missing a part here, which is part number what? 2. But the amount of antigen on the cells is normal, meaning, let's assume it has this large normal quantity here, and we removed from them all part number 2. So it is a structure missing a part, but the quantity is normal. And this is what we call what? Partial. This is the last case we have. The antigen structure is incomplete. And also the number on the cells is less than normal. Meaning, like here, for example, if we removed from these antigens, we removed part number 2, as we said, as we agreed. So, as a structure, it is missing a piece. And in number, it is low. And this is what we call what? The weak partial D. So, normal or weak or partial or weak partial, normal structure with normal quantity. Normal, this is a normal structure, but the quantity is a bit low, so it is weak. This one is missing a piece of its structure, but the quantity is normal, so it is partial. This one has a problem with both the structure is missing a part and the quantity is low, so this is the weak partial. Now, where will everything become apparent if we have a normal positive donor? If we dispense this bag to a positive patient, then there's no problem. But if it is dispensed to a negative patient, of course, that will not work because the patient's body will then form anti-D. If our donor is negative, then his bag can be dispensed to a positive patient, whether normal or partial, any positive patient. And of course, to a negative patient like them, right? If the donor is partial, which is missing this part of the antigen every day. So we will dispense it. If we consider it positive as is, we will dispense it to a positive patient, whether normal or partial. Okay. But if someone calls it negative and dispenses it to a negative patient, that's a problem. Their body will develop anti-D. If there is a patient, like here, we have already seen the situation with the donor. And what would happen if we considered it positive or partial or negative in various cases? Now let's look at the other side. If we have a patient or a recipient, what if the patient is of the partial type, the one where part of their antigen is missing? For this partial patient, if we dispense a unit, normal, meaning the donor is normal, meaning the antigen has its full natural structure. What will happen then when it enters the body of the partial patient whose cells, as we said, have the antigen with an incomplete, unnatural structure? The patient's body will develop antibodies against the extra part, which is number 2, the extra part that will enter the body. And that is why for a patient we call Pargezol Purmushut. What do we dispense for them? Negative cells. Of course, the situation differs slightly. With more capabilities, the situation becomes clearer. It is the same if we have a case, a female, and whether this case will receive the anti-D injection or not. It is exactly the same. What if she is partial and the fetus is normal? Like this, then her body will develop anti-D. That's why this partial case, this partial female case, should be treated as if she were negative, minus, and she must receive the anti-D injection so that if the fetus is normal, her body doesn't develop anti-D. Okay? Okay. For all of this, our reagents have D6 positive and D6 negative written on them. What does this mean? What does this mean? Weak D comes in many types, and partial D also comes in many types, not just one. It's one of the most famous types of partial D is called D. That's why our reagents, there is a type labeled D6 positive. What does that mean? That the reagent can give us a positive result with this type if it reacts with this partial type. And what if it's negative? Means that it will give us a negative result if the sample is of this type. Let's apply this. If we are testing a donor's sample, what do we want? We want the reagent to detect this type and tell us that the donor is positive. So what? So we can dispense this unit to a positive patient, as we said. But on the other hand, it's the opposite. If a patient is receiving blood, or a female case, we said we'll receive the anti-D injection or not. We want the reagent, if the patient is of this type, not to react with it, not to detect this type for us and give us a negative or even a weak result. So that then we can say, or then dispense negative to the patient. And if it's a female case, she takes the anti-D injection. Did that get through? All right. We will stop at this point today. Your brother, Sharif Abdel Monim, was with you. Until we meet again, God willing, in the next clip